Hey guys, it's Dave. Today we're going to talk about SSRIs, or selective serotonin reuptake inhibitors. Antidepressants is what we're looking at. I get a lot of questions on these and how they can be used and what they're used for, uh, and really what they're used for. They're indicated to be for treatment of depression or anxiety. However, there are a lot of off-label uses for those, meaning that they've not officially been approved for use in these conditions or to treat these disease states. Doesn't mean they don't work. There just has not been enough studies out there. And if we get more people on them and more providers actually documenting their use for that, they may be indicated that for these things later on. First one that they use it for is vasomotor symptoms, especially post-menopause. So ladies that are having things like hot flashes, um, mood swings, you can have emotional instability like that. Fluoxetine is the main one, but there are other ones now being used for it and having some success with it. We are seeing some use with sertraline, and that's been having some success, as well as citalopram. Another thing that they're using some of the SSRIs for is obsessive compulsive disorder, OCD. The one there that is really having some good success is Luvox or fluvoxamine. Again, remember, just like with using it in the antidepressant realm, you want to start with a low dose and taper on slowly. Okay? Now, with some of these states that I'm talking about, it's not going to take the 6 to 8 weeks to see results like it does with depression. Others it does. As far as the vasomotor symptoms that I talked about with postmenopausal women, generally you'll see that a little bit quicker, helping out with some of the hot flashes and things like that. OCD, it's going to take longer. Something else that you can see them being used for is impulse control disorder. So if you have somebody that maybe likes to gamble a little too much, likes to drink a little too much, buys things, that is something that we're finding more and more often. And it can be a really desperate situation. You get on Amazon, you just can't quit buying. You get on the internet, you just can't quit buying. And then guess what? Somebody's got to pay the bill. So impulse control disorder, they're also having some success treating it with citalopram, which is generic Celexa, 20 to 60 milligrams a day, starting out again low, building up, going slow. And fluoxetine is the other one, 20 to 60 milligrams a day. Relief with migraine headaches, but not on an as-needed basis. You have to take it every day. And with migraines, fluoxetine again, 20 to 40 milligrams a day. That's going to take a while to kick in, but not the 6 to 8 weeks for depression. Generally, you'll be on that for a couple of weeks, and the way that it's working, it will help reduce your migraines. Irritable bowel syndrome. This has actually been used for a long time. More likely, tricyclic antidepressants like amitriptyline have been used for it, but they have started using paroxetine or generic Paxil at 5 to 20 milligrams a day with success. So you can have it on a lower end and get results. And again, that's not going to take 4 to 6 weeks with that one. It'll take a couple of weeks to kick in, but it's basically the way they think that's working is more the side effects of the serotonin reuptake inhibitor is actually what's doing the work. So a little bit different on that. Something else that they're using it for is premature ejaculation. That one, again, is not, you have to take it every day to see the results. It will take a little bit of time to build up in your system. But paroxetine, 10 milligrams, basically 10 to 20 on that once a day, seems to work the best. Now, there have been a few studies where they kind of used it like Viagra on demand, where they took it half hour before intercourse and it worked. But from what I've read, it seems to work best if you do it on a daily basis. Not saying it's not going to work for you to do it just when you need it, But if it doesn't work for you that way, you may consider taking it every day. Talk to your provider about that. Something else that they use them for is body dysmorphic disorder. When you have a different image of your body than what everybody else around you sees. And it really becomes a mental issue for you, and it can affect you in a big way. And the one that they use the most often for that is Celexa or Luvox, which is fluvoxamine again. And again, that is where you're obsessed with a certain aspect of your body. Maybe your ears, could be your feet, doesn't matter. People are having difficulty with what they perceive as what's wrong with their body, a certain body part. And again, Celexa, which is citalopram, or Luvox, which is fluvoxamine, has been used for that. Something else that they're treating SSRIs with is hypersexuality. So when you are in the mood all the time to the point where it's disruptive to you and your relationships, friends and families and things like that. Honestly, there are no good studies for SSRIs with that, but they have tried several of them out there with moderate success. I'm going to tell you, and I've looked at this and found some older studies regarding it, but a drug that you can use for that actually will give you better results is Tagamet or cimetidine. And I have seen that personally with a patient where that has worked.